Hello and welcome. Today we'll be diving into bladder dysfunction, a common condition affecting millions worldwide. We'll explore what it is, why it happens, how it's diagnosed, and what can be done to manage it. Bladder dysfunction can stem from a variety of causes. These include neurological disorders like multiple sclerosis, Parkinson's disease, and spinal cord injuries which disrupt the nerve signals controlling bladder function. Obstructions, such as an enlarged prostate or bladder stones, can hinder urine flow. Infections like urinary tract infections or bladder infections can irritate the bladder lining and lead to dysfunction. Certain medications, particularly those with anticholinergic effects, can also impact bladder control. Finally, in some cases, the cause remains unknown, referred to as idiopathic bladder dysfunction. The pathophysiology of bladder dysfunction depends heavily on the underlying cause. In neurological disorders, the brain and bladder's communication network is compromised. This can result in an overactive bladder, where the bladder contracts involuntarily, leading to urgency and frequency. Conversely, it can cause an underactive bladder, where the bladder muscle fails to contract properly, resulting in urinary retention. Obstructions physically block the flow of urine, increasing pressure within the bladder and potentially damaging the bladder muscle over time. Infections trigger inflammation, irritating the bladder and causing frequent and urgent urination. In idiopathic cases, the exact mechanisms are less clear, but may involve subtle abnormalities in bladder muscle function or nerve sensitivity. The epidemiology of bladder dysfunction varies depending on the specific type and the population studied. Overactive bladder, for example, is estimated to affect millions of adults. Urinary incontinence, a common symptom of bladder dysfunction, is more prevalent in women, older adults, and those with certain medical conditions. Neurological diseases significantly increase the risk of developing bladder dysfunction. While precise numbers are challenging to gather due to underreporting, bladder dysfunction represents a significant public health concern with considerable impact on quality of life. The signs and symptoms of bladder dysfunction are diverse. Common symptoms include frequent urination, often more than 8 times a day, urinary urgency, the sudden and compelling need to urinate, nocturia, or waking up multiple times at night to urinate, urinary incontinence, which is the involuntary leakage of urine, difficulty starting or stopping urination, a weak urine stream, feeling that the bladder is not completely empty after urination, and pain or discomfort in the bladder area. Diagnosing bladder dysfunction typically involves a thorough medical history and physical examination. Urine tests are performed to rule out infection or other abnormalities. Bladder diaries, where you record your fluid intake and urination patterns, can provide valuable insights. Aerodynamic testing is a group of tests that measure bladder pressure, flow rates, and muscle activity during urination. Cystoscopy, a procedure where a small camera is inserted into the bladder, allows for direct visualization of the bladder lining. Imaging studies, such as ultrasound or CT scans, may be used to identify structural abnormalities. Bladder dysfunction is a broad term, and specific classifications depend on the underlying cause and the symptoms experienced. Common types include overactive bladder (INGO), characterized by urgency, frequency, and often urge incontinence; underactive bladder (SUEB), where the bladder doesn't contract effectively, leading to retention; stress incontinence, which is leakage due to physical exertion like coughing or sneezing; urge incontinence, which is leakage associated with a strong urge to urinate; overflow incontinence, which is leakage due to a chronically full bladder; and mixed incontinence, a combination of different types. Treatment and management strategies for bladder dysfunction depend on the specific diagnosis. Lifestyle modifications, such as limiting caffeine and alcohol intake, bladder training, and pelvic floor exercises (Kegels), are often the first line of treatment. Medications, such as anticholinergics for overactive bladder or alpha blockers for urinary retention due to prostate enlargement, may be prescribed. Interventional therapies like Botox injections into the bladder muscle or sacral nerve stimulation are options for more severe cases. In some instances, surgery may be necessary to correct structural abnormalities. Preventing bladder dysfunction is not always possible, but several measures can reduce your risk. Maintaining a healthy weight, practicing regular pelvic floor exercises, and avoiding excessive caffeine and alcohol consumption can help. Promptly treating urinary tract infections can prevent them from progressing and causing further complications. Managing underlying medical conditions, such as diabetes and neurological disorders, is also crucial. Adequate fluid intake is important, although it should be balanced to avoid overfilling the bladder. The prognosis for bladder dysfunction varies depending on the underlying cause, the severity of symptoms, and the effectiveness of treatment. Many individuals can experience significant improvement in their symptoms with appropriate management. While some cases may require ongoing management, others can be effectively resolved. Current research is focused on developing new medications, improving diagnostic techniques, and exploring novel therapies such as gene therapy and regenerative medicine to further enhance the treatment of bladder dysfunction. Thanks for watching. Consult your doctor for a proper diagnosis.